So one of the awesome herbs that I really like talking about, and most people don't seem to know about, is actually called Tomcat Ali, or Uricoma longifolium. And in my clinical experiences, when I'm working up a patient for andropause or low testosterone symptoms or anything along this line, actually this plant at the proper extraction has been shown to increase testosterone. I can see it in the lab results in a very short amount of time that this plant, when given, can increase testosterone. There's just some studies there listed. And it's just saying that it's also good for bone reabsorption, so keeping these bones nice and healthy with that testosterone. So kind of going a little bit into our vitamins and minerals. Zinc is usually thought of a little bit more as a male mineral, where copper usually is more geared toward the female minerals. So zinc actually has been shown to, once again, increase that testosterone to help with infertility and kind of balance your hormones out as a male. Vitamin D. We hear about vitamin D and we see vitamin D everywhere. It's all over the news, and I'll talk about a little bit about this at the end in regards to prostate cancer. But vitamin D supplementation has been shown to increase testosterone levels as well. It's a receptor that's everywhere in the body. Boron, which is another mineral, has been shown to increase testosterone levels. Once again, I have had a patient who we put on boron, whose testosterone levels went up. They weren't on the Tomcat Ali, but they went on boron, and it was the same kind of effects. So all these vitamins and minerals, this is stuff that we're supposed to be getting from a diet. But if you're not eating the proper diet, you're not necessarily getting the proper amounts. This is just saying the same thing with magnesium, that magnesium is at adequate amount in your body. You're going to have a little bit higher levels of testosterone, and this was found in actually athletes. So ashwagandha, it's an herb, Withania somniferum. We usually use it a lot if you have a lot of stress or anxiety, and we usually use it a lot in people with blood type O. That doesn't mean necessarily it's only for blood type O's. But pretty much along this herb, we saw that an increase in the male hormones, a decrease in the female hormones, and kind of a balancing out of the other hormones with ashwagandha being used as a therapeutic agent. Just one of those upstream modulators that we were talking about a little bit ago, mucuna, is also called dopamine, can help with the upstream modifications of the hormones, so that way you have the testosterone come about naturally. And just a side note, if anyone's ever heard of the doctoring signatures, the dopamine itself kind of almost looks like a prostate. So back way when even the Native Americans, they saw something in the plant that kind of looked like the body part they were trying to pretty much affect. They noticed that, and that's kind of how the progress of medicine came about. And later on, when we were actually able to study these different plants and the chemicals that are in them, we noticed that, oh, there's some truth behind all that history of use. This is just showing that mucuna or dopamine can help infertile men increase semen quality, which has again to do with balancing hormones out, the male hormones. And there's so many more that you can choose from and play with, and I could talk about. But it's just kind of a little brief overview. As with any medication, there are pros and cons to each, and it's really important to talk to a physician to see what's going on. And naturopathic physicians are actually the only ones trained in this country to figure out the drug-herb interactions. Because when we give you something, we want to make sure that you're not going to have any side effects. Also the same too, dosing vitamins and minerals. Remember that you are unique, so your doctor should look at you as such and actually treat you accordingly. So you're an individual person and you should be treated individually, personalized. And naturopathic physicians, we can also test your hormone levels, which you can take all this stuff and maybe it won't do anything, but it might not do anything because you don't need it. So you want to know why you're taking something first. We want to have some kind of test validity so we know if it's actually indicated for you. So we're just going to go over a brief little section on benign prostatic hypertrophy, or BPH. Once again, that big red structure up there is going to be the bladder, and that's where the urine is kept. And right below it, you can see on the right-hand side is a normal prostate. It's about the size of a walnut. And on the right, left-hand side is actually prostatic hypertrophy, or that benign prostatic hypertrophy. So it's increasing that cellular size. That increase in cellular size can cause a whole bunch of different kind of issues. Now we see the top of this picture, we see the bladder and we see the prostate. So when you gotta go to the bathroom, when you gotta urinate, the bladder, you want the urine to come out of the bladder through the prostate and into the toilet for the most part. So in a normal prostate, it comes out nice and smooth. Now if that prostate enlarge, that enlargement is going to put more pressure on that tube that's going to transfer the urine into the toilet. That's something we want to avoid. And some of the symptoms of that enlargement of the prostate are, the obstructive symptoms are anyway, hesitancy when you're trying to go to the bathroom. You're not going to have as increase of a stream. It's not going to be as fulfilling to empty your bladder all the way. You have a forced streaming when you're going to the bathroom or double voiding, and journaling and dribbling. Some of the irritation symptoms can be, you gotta really go, and you get there and you can't go. You're going a lot to the bathroom. You're going at night to the bathroom, and it becomes painful or burning. So demographics, it affects over 50% of males in their lifetime. As you can see, actually the risk increases with age. So we see from the 40 to 50-year-olds, the 20% risk, and then as we go up to the next decade, the 50 to 60-year-olds is 50%, and then as we go up a little bit further, 80 to 100 for the most part, it's pretty much a 90% risk that us men are going to get this condition. So what does that mean for blood types? So we'll go into a little bit more detail about the blood type and risk of BPH. Pretty much across the board, we're all pretty much prone to get BPH. It seems to be a normal kind of process the body's going through, at least at this stage of our understanding. But we can see that anyone who has that A antigen or that A blood group, so blood type A or blood type AB, seems to have a little bit more increased risk of getting BPH. And we can also see that it's the same for anyone who has a secretor. So any of you guys are non-secretors, you have something going for you, less likely to get BPH. So cause of the BPH is widely unknown. We don't know necessarily what it's caused, why it's caused, and the allopathic world anyway. But NDs believe in a multifactorial approach. There's many different reasons causing the BPH, causing that enlargement, causing all those symptoms. So there can be anything from previous infections, inflammation, parasites, heavy metals, toxins, hormone disruptors, etc., etc. I can keep listing them one and one. We talked a little bit about those a little bit earlier. So some of the naturopathic treatments that we can do, once again, that genotype diet, blood typing, 5-alpha reductase inhibitors, pumpkin seeds, saw palmetto, watermelon, and quercetin. And we're kind of going to break this down a little bit into blood types and what's really good for the different blood types if you have the BPH. But we want to always remember, we want to use food as your medicine and medicine as your food. This is a basic foundation. This is actually what the father of Western medicine said. Use food as your medicine and medicine as your food. To set that structure up, make that bridge so you can go out into the future with a lot of vitality, a lot of energy, and being healthy. And one of the things I always do with my patients when I'm trying to help them along, what I'm trying to do is I tell them that we're trying to give the body what it needs, so it has all the building blocks. We're taking out the trash and make sure they're detoxing properly, they're going to the bathroom, having bowel movements every day, and increasing vitality. And that increase in vitality is that willingness to live, kind of gives you the sparkle in your eye, gives you that energy, you're like, yeah. That's kind of along the lines of our treatment plans that we try to do. So people with blood type A, pumpkin seeds, as you can see, are actually very good for people with blood type A who have benign prostatic hypertrophy. You can also see up there an herb called Urtica dioica, which is actually called stinging nettle. It's all over the place. You ever been in the woods and you walk by something and all these little needles it feels like in you? That's stinging nettle. It's actually been shown to be very beneficial in people with blood type A. And also another plant that we'll talk about a lot, Serenoa, which is called saw palmetto. We actually have two of these on campus too. It's actually a palm tree, believe it or not. We have them in the garden. It's just right next, really close to the buildings, so it keeps them warm. So they actually haven't died yet. It's been like a couple years. It's been at least 4 years. So, for people with the B antigen or blood type B, Serenoa is going to be really good. But also amino acid, of course, arginine. Arginine can be found in egg yolks and many different types of things. And that's just a picture of saw palmetto, the palm tree. Blood type AB, saw palmetto seems to be really good, arginine is really good, but also a chemical constituent that's found in watermelons called lycopene is actually very beneficial. Blood type O's, my favorite, because I'm blood type O. Urtica, or stinging nettle, is going to be, once again, really good, and also that pumpkin seeds. Pumpkin seeds are going to be very beneficial for them. And that can be due to a couple different reasons. We were talking about zinc earlier as a way to increase in testosterone, and pumpkin seeds actually are higher in zinc. So kind of that connection of trying to use your food as medicine. And this is just a little tiny study. This is actually on a 19-year-old, which we were talking about a little bit earlier, of this gentleman who was he was a vegan for the most part. And he was getting symptoms of kind of not BPH, but andropause, low testosterone, this kind of stuff. And when he changed his diet to one that actually consisted of a little bit more protein, a little bit more animal protein, all of his symptoms went away. So once again, that diet can get those symptoms away. Granted, he's a really young, kind of vital, energetic person at being 19, but yeah, diet and changing it so you're eating right for your type, you're eating right for your blood type diet. And I just kind of threw that in there because it kind of sounded like a blood type O who's kind of eating like a blood type A. And it seems to be all blood groups are good with zinc, and they're good with the amino acids alanine and glycine. There's a little information about stinging nettle. Once again, it's that plant that if you're walking in the woods and it brushes up against your leg, you get those nice little prickers in there. It kind of inhibits the sex hormone binding globulin, which is that Pac-Man molecule that we're talking about. And it's been compared to other prescription medications in reducing the side effects from BPH. And also kind of increase the inflammation, so you can decrease your pain. It's actually used as a medicine in Germany, as a patented medicine. And it has many different advantages, but pretty much reducing that sex hormone binding globulin. So you can actually use the testosterone that's in your body for something beneficial. Another study shown that nettle decreases that sex hormone binding globulin. Serrano, which is saw palmetto, that palm tree that's kind of around campus, the little tiny palm tree I should say, you're not going to see a big one. But it's actually a Native American food that's been used for thousands of years. It actually stops the conversion from the testosterone, your good testosterone, into something called DHT, or dihydrotestosterone. And we want to keep up the good testosterone, not going toward the bad testosterone. High levels of DHT can actually cause male pattern baldness. And it seems to be just as effective as finasteride, which is a prescription medication for mild to moderate benign prostatic hypertrophy. Quercetin, which can be found in many different foods, apples and onions. I always think of onions when I think of quercetin. It's we use it a lot to modulate inflammation, so to kind of decrease that pain a little bit. But this is just interesting from the Mayo Clinic. It may help treat or prevent prostate cancer by blocking male hormones that encourage the growth of prostate cancer cells, according to the Mayo Clinic. And we actually have a product Dr. Dianamo put together a product anyway that consists of many of these, the stinging nettles in there, the saw palmetto, and of course it's all in this product called Genoma EQ. And once again, it's to help modulate prostate health and immune function. So erectile dysfunction, aka ED. Now we always see all those commercials on the TV, the people sitting in the bathtubs. It seems to be all over the place now with the direct-to-marketing advertisement of the prescription drugs. In the medical world, though, it's known as impotence. And it's pretty much, impotence is a lack of effect of a rush of blood to the tissue, to the penis. So this has actually happened in about 40% of males, and it can have many different factors of why it's going on. It can be psychological, and it can be physiological. So just kind of see the prevalence of erectile dysfunction throughout the ages. As we increase, we're more prone to erectile dysfunction. And if we actually look at the same chart that I showed you earlier, testosterone is going down at this point as you age, sex hormone globulin is going up during this age as well. So causes, there's many different causes, but kind of the big ones are cardiovascular diseases, so any kind of heart diseases, diabetes or diabetes mellitus, and prostate surgery, if you've had prostate cancer in the past, can actually cause erectile dysfunction. There's hypogonadism, or as male andropause, or low testosterone. It can be psychological problems, so something's going on where you're not able to get an erection. It could be just mineral deficiencies. Potassium is a mineral. Kidney diseases and smoking can have a major role. Stress and lifestyle, once again, that basic foundation. Trauma, hypertension, and different pharmaceutical drugs. So some of the pharmaceutical drugs of note, just different diuretics that you use if you have maybe heart problems. We also have cardiovascular drugs, so any kind of, if you have high blood pressure or anything like that, they can cause erectile dysfunction. Some antidepressants, and also some ones that kind of help your stomach, the H2 agonists.